Welcome, 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 as they say in the church. Welcome once, welcome twice, welcome thrice.
Okay, hello everyone. So we're about to officially start our events. My name is Briana Dawson. I'm the Community Health Campaign Manager, and assisting me in the background is MyLinn, if she just wants to say hi real quick and then flip to the next slide.
Hello everyone, my name is MyLinn Clément. I'm glad to be here and learning everything I can from you.
Can you go to the next slide, MyLinn? Okay. So yeah, some interesting facts about myself is that I'm a content creator. I'm a small business owner / dance instructor. I'm also a senior at George Mason University. And of course, I work for Elevate Her as a community health worker.
Hi, I'm also, I am also a community health worker. I'm a Black belt in Taekwondo and I love international travel. And I'm an HBCU graduate from Spelman College.
Next slide. So how the night's gonna go. So of course, all the presenters are going to introduce themselves in just a moment. They're just going to tell you guys their job titles and their names, but the order will go, we'll start off with the presenter, Ashley Dawson, and then we'll have Dr. Coots and his daughter, Catalina Coots. Then we'll also have Belinda Queen and Traci Jones from our Prince George's County School District. And then we'll also have Rachelle from Maryland University, and of course, Valarie Davis from Elevate Her. Next slide. So we're going to start introducing ourselves. I'm going to mute myself and we'll start off with Dr. Coots.
Yeah, hi, I'm Van Coots. I'm a dermatologist by training. I am the president and CEO of Holy Cross Health, which is a 2-hospital system in Montgomery County. And with me, I have my daughter, Catalina.
Hello, everyone.
Hi, I'm Ashley Dawson. I'm the Health and Behavioral Research Analysis for Elevate Her, and I'm a senior at George Mason University.
Good evening, everyone. My name is Valarie Davis. I am the founder of Elevate Her, and I am an unapologetic public health Blacktivist, and I'll tell you more about that later.
Good evening. I am Belinda Queen. I am your District 6 Prince George's County Public School Board of Education member. And with me, I have Ms. Traci Jones and our senior advisor, Mr. Howard Burnett. Ms. Jones.
Good afternoon. Thank you for having me. I am Traci Jones. I am the nursing supervisor for the Office of School Health for Prince George's County Public Schools.
Mr. Burnett.
Good evening. I'm just here to represent our CEO, Dr. Monica Goldson, and to support Board Member Queen and our Health Supervisor, Traci Jones.
Hi everyone, my name is Rachelle Wakefield. I'm a senior public health science, public policy, dual degree with a minor in sustainability at the University of Maryland, College Park.
Hi, my name is Catalina Coots, and I am a 7th grader. I am the treasurer of my school student council. I like to ride horses. I like to play volleyball, tennis, and basketball, and I love reading.
So hi again, my name is Ashley Dawson, and I'm the Health and Behavioral Analysis for Elevate Her. And as a community health worker, I was on the ground level providing COVID relief and aiding in the crisis response for underserved communities. I've seen how misinformation and inadequate resource distribution affects our community. Also, in order to improve the overall health of the Black community, it takes community needs assessments to know that there is difficulty in navigating resources, paying bills, and finding jobs. The reason I'm here today is because PG is my home and it's where I grew up. So I really care about improving the health of our community. And some fun facts about me is I'm in the Accelerated Masters in Public Health at George Mason University. I'm a dance studio owner, a twin, and a community health worker. So let's get started with the next slide. So first I'll be addressing how many Black adults were included in clinical trials and why is there a disproportionate inclusion. So for Moderna, there was 10% or 3,000 participants were Black. For Johnson & Johnson, 13% participants were Black, and for Pfizer, 10% or 4,000 participants were Black. Although clinical trials only consisted of less than 15% of African Americans, it is important to note the hesitancy brought on by new vaccines and past unethical practices that affect clinical trial participation. In addition, barriers such as mode of transportation and lack of standard regulations for equal racial representation in clinical trials impact the generalizability of participants. It is most important to note that only 13% of the total United States population is Black, and that right now the vaccine is the only preventative measure that we have to ensure that you don't die from COVID. Next slide. So now I'll talk about Black susceptibility by addressing the question, I'm young and healthy, so why would I risk getting sick from a vaccine that doesn't even work without a booster shot? So with that being said, let's dive into which age group has the highest case of prevalence. Surprisingly, 18 to 29 are most susceptible. There are many things alluding to this alarming impact. There is a very real misconception that COVID-19 is only detrimental to the elderly population. Beliefs that COVID is nothing more than a cold, the vaccine was created too quickly, and that this is just a way for the government to get control is the opinions that are very prominent among our community. However, studies have shown that in the age group 35 to 44, Black people are dying at a similar rate as white people more than a decade older than them. Moreover, at least one pre-existing condition such as hypertension, diabetes, or obesity cause those under 35 to present the same outcome as someone over 50 without those conditions. That being said, our youth and young adults' continued belief of a bounce back resilience or a decreased susceptibility is very dangerous. In Prince George's County alone, more than 18,000 of individuals ages 20 to 29 have COVID. This is nearly double the rate of cases among those ages 60 and up. The death rate among Black people is now 45% higher than white Americans. Overall, the life expectancy of Black people as a whole has dropped from 71.5 to 74.7 since COVID, and we are 3 times more likely to contract COVID than white Americans. Therefore, susceptibility is felt by all ages, and one should not confuse COVID for being only detrimental to the elderly. Now I'll briefly talk about booster shots. The circulating question among many is, why is there a need for a booster shot? Booster shots are created to uphold the robust immune response effective vaccines against the emerging variants. Booster shots have shown a statistically significant increase in the immune response with few symptoms. Booster shots contain the same ingredients as seen in the previous vaccine and have the same associated symptoms. These symptoms are minuscule in comparison with the economic devastation you will experience if you catch COVID and are unable to work. In the race for life, the overall goal is to build a strong immune system against variants as they emerge. Currently, the booster shot is the next recommendation from the CDC and the FDA. Next slide. Lastly, I'll be addressing, is there a correlation between deaths and the vaccine? Firstly, I will acknowledge that anyone can report adverse effects to the vaccine adverse event reporting system. However, this system allows anyone to report allegations and they are not confirmed. Over 5,343 deaths were reported. The CDC has reviewed these reports through examining clinical data, death certificates, and autopsies. No evidence suggests a direct causation of death from the vaccine. Moreover, the CDC has also did a comparative analysis of those vaccinated and those who are not vaccinated by ages, sex, and race. The main takeaway there is that no increased risk among the vaccinated. Therefore, no direct correlation has been found between the vaccine and death. Overall, health is a basic human right that is an obligation of the state to uphold. One way they are ensuring this is by providing the free provision of the vaccine. For me, I chose to get vaccinated because I wanted to protect my family members who have underlying health issues that would create COVID complications. So now it's your chance to make your own decision about how you would like to take care of your health. Thank you. So thank you so much, Ashley, for giving us that little speech. Are there any questions for Ashley Dawson, or we will move on to our next speaker?
Also, did everyone get a chance to take the poll? Come off your speaker. Did you see it? Did
Yep,
y'all
I
see
took
it?
the quiz or the poll.
Do we have the results? Okay. Oh, all of the above. Okay, but not, all right.
Hi, this is Jackie Harris, longtime friend of Valarie Davis. Question for Ms. Dawson, and I'm accountant, numbers just stick in my head. You mentioned the life expectancy of African Americans you said it dropped from 71 to 74. Is that from 74 to 71 years of age, or was that a different number? Do you remember that?
Yes, so the original life expectancy of African Americans was 74 years of age, and now we have dropped to 71.
Okay, thank you so much.
So before we move on to the next presentation, if we could just stop sharing the screen for a second. Thank you for asking that question, Jackie. This is a conversation, y'all. And Ashley just dumped a bunch of stuff out there. And I can't see everybody's face, so I don't know how you're reacting. So before we go on, how are you reacting to this? What is this surprising to you, this information? What is your reaction? I see Miss Gloria's got something to say. I knew you would. Come on.
Well, it wasn't a surprise. I stopped being surprised, but it confirmed my thoughts. Being relatively new to the county, I'm still learning the demographics. And I'm also saddened by the fact that we seem to be lacking in enough, not that there isn't information, but we seem to be lacking in believing the information that is there because it's based on myths and stereotypes from so long ago. And being a veteran neuropsychiatric nurse myself, I had a hard time convincing the guys that were coming into the hospital from Vietnam that just because the government was not admitting to Agent Orange did not prevent them from taking the medicine that we were trying to provide for them. So there's always a hesitancy, but we must keep on making sure that we keep them aware that it is safe, because it is safe. And if you don't know it's safe, you're going to die.
Other reactions? Thank you, Ms. Gloria. What do you think about that clinical trial data? Do you feel like we were represented or no? Or you still have questions? Are you skeptical? Would you sign up for a clinical trial? What do you think?
This is Jackie Harris again, the numbers person. So I was paying attention when she said about 13% for Moderna, I think, and 13 for Pfizer. I didn't write it down, but they were in the low, they were low, 10, 13, they were low, and one was 4-ish, I think, Ms. Dawson. But she also said the percentage of African Americans in the demographics in the US was 13%. So it's almost proportional in a way. I don't know if that makes a difference.
And this is Board Member Queen, and in reality is that African Americans have never been the first to jump up to try something. And I can't see them jumping up to try this either. A lot of us always been, taught, you put your hand in the fire, you get burnt. So even now as children, as youth, even as adults, we watch to see what's going to happen to someone else. So, and I just think that's just the way a lot of us was grown up, even as African Americans, that we're not going to just jump right out there because they say that's right. It's only so many people that's willing to get out there and do a trial on certain things. And that has always been. So I believe that 10% was really a great number compared to what reality is. Things have changed. More people are jumping out there. Even our younger generation seem to be jumping out to do a little bit more. So the number of the 10% was really not that bad when you look at it.
Ms. Bisola, you're on mute.
Yeah, I'm concerned to know, how do we know about the safety of these vaccines? And why are we disparaged from not trusting the United States to provide us with safe medication, given the history of the misuse of medicines against us, the misuse of allowing us not to be healed and to use us for experiments. So what I don't understand is why people don't understand the level of disbelief given where we live and given our history. So I just want to know, how are we not acknowledging that? And then if we could acknowledge that, the reality of what has been done, and then maybe we could build from that to a more receptive framework for people to receive. That's my question.
Well, let me say a couple things. I had to let the dog out of the room or else he was going to go nuts. One of the things that is a guiding principle of all of our discussions and all of our community health work at Elevate Her is that we start from a place of acknowledging and affirming where people come from. This is not a place that starts with you're wrong, we're right, let us tell you anything. And we also are not here to convince anyone of anything, right? Because we believe in agency. And you get to decide what happens with your body. It's part of what you talked about, Ms. Basola. So we acknowledge and we affirm that all of that is so. Now, the question of why institutions don't want to acknowledge it, or why decision makers do or don't acknowledge it, is a different question and an important one. And as we move into the next phase where Dr. Coots is going to talk about some stuff, you might pick up there and just give your view, because you've been in the military, you're a part of the healthcare system, you've got kids, so you've been navigating the education system. You've worked a lot of systems. You went to medical school. That's a whole system, right? Right? I mean, won't talk about the lack of Black doctors that we have.
I know Ron has his hand up, Miss Valarie, but before we do move on, you know, I guess because I've raised so many children, you guys, I really love to give example, but I want to give this quick example. It's still some states that don't have it where we have to wear a seatbelt. And just think about it. When I grew up, we never had to wear seatbelts. It was just like, you know, kids were all over the place. We were in station wagons. We were on the back of trucks. But it wasn't until more drunk drivers got out, more accidents happened. So it wasn't until after a time, then the state of Maryland and other states decided that we have to wear seatbelts. And that's how it is with anything else. You know, and the same thing with COVID. It isn't until a period of time. Some people still have to wait and see, and there's still some states that don't have it as a law, to be honest, you know, so it's not really everywhere, but some things have to build up, and that's with everything. So when you ask that question, why people, and it's the same way, some people feel the same way. I'm gonna be honest with you, and I'm gonna give you an example. I was in a car accident, and if I, and to be honest with you, if I had my seatbelt on, I wouldn't have made it out the car. And so I was skeptical for years. Even after the seatbelt law had passed, I wouldn't wear my seatbelt because I remember a time that I almost didn't make, and that I couldn't get that seatbelt, you know, loose. And you know, and so it was like, oh my God, I'm not gonna make it out the car if I had my seatbelt. But as time went on, I started realizing, okay, I gotta be a good example for my grandbaby. Gotta button this seat back up. This is a different time, different generation. So as things go on, we start changing our way of thinking. And that's what happens with anything else, because I realized it wasn't about my fear of that time. I wasn't want to be able to get them out the seatbelt. It was about me realizing this is a whole nother generation. And as an adult, I got to do right things to teach my grandchildren to do the right things.
Yeah, you keep saying, you mentioned over and over time. My dad is gone now, but he used to say, time tells everything. Internally, time will take you to places that you may not have thought you would go. It'll also show you who other people are. And making a decision about your health and deciding who you can trust is time bound in some ways and experience bound. So I'm gonna thank you for sharing. Y'all keep sharing. You can type in the chat. You can ask questions in the chat. I'm going to turn back over to Briana so she can navigate us through the next section. But thank you very much, Ashley, and thank you for all your participation.
Well, we have time for one more question. So
a lot of times I hear that the vaccine was pushed out too quickly. And I don't know if anybody wants to respond, but when people say that it was pushed out too quickly, do they mean that, or in your interpretation, do you mean that there wasn't enough study done around the vaccine itself for you to say that, okay, this is something that I can take? Because, you know, a lot of people may or may not know, but, you know, coronavirus is just a virus, and we've seen coronavirus in our lifetimes before. So it's not that, you know, the vaccine just came out of nowhere based off of, you know, there's like prior science that would help them to create this vaccine in a smaller amount of time. And so, you know, scientists, you know, they spend their lives, their work creating vaccines, or, you know, supposedly preventing things that like this that happen. So I just want to know if anybody wants to jump in. Like, when you say that the vaccine was pushed out or created too quickly, do you mean that there wasn't enough studying done, or that just the actual rollout of the vaccine itself made you uncomfortable with taking the vaccine?
I would just say a quick fun fact is that the safety testing and production was conducted at the same time to ensure that there was an ample supply for this emerging crisis. So that might make it seem like it was done rather quickly, but it was just because it was done simultaneously at the same time, which has not been done previously. And we will have to move on to the next presenter now. So please put back up the slides.
But if you have a response to what Vanessa was thinking, just even your own or someone else's about this, it was rushed, it was too quickly. What do you think people mean by that? Go ahead and type it in the chat. Thank you.
Okay, so I'm Van Coots again, and if we can go to the next slide, there are three things that I really want to talk about. Just kind of what we're seeing in terms of hospitalizations right now. Remember, we're at week 90 of our response to this pandemic, a disease that has infected millions and has killed about 750,000 right here in the United States alone, about 5 million around the world. Right now, our hospitalizations are down into about the 20s or 30s here in Montgomery County and in Prince George's County. Across the state of Maryland, Maryland is actually doing very well in terms of total vaccinations, and so our numbers are fairly low. We've also been very good at doing the distancing, the hand washing, the mask wearing, and things like that, as opposed to other states. So we're sort of at a steady state right now, where every day we have about 20 or 30 patients in the hospital. We admit patients every day, we discharge patients every day. So it's sort of gotten to a steady state. This is primarily hospitalizations of the unvaccinated right now. I don't want to call it a pandemic of the unvaccinated, because I think that that's unfair, but it truly is more of the unvaccinated patients that we're seeing hospitalized right now. And daily we have new admissions of pregnant African-American and Hispanic young mothers who are delivering COVID positive babies. So we have a lot of hesitancy in that age group and in those two ethnicities. We're also seeing, unfortunately, vaccinated patients who are being hospitalized and some who are dying, but these are patients who have underlying health conditions. Some of them are the older populations, many are African-American, many are Hispanic, but they have comorbid conditions such as cancer diagnoses, which are also very advanced in weakening the immune system, or they have hypertension. So they have problems with their blood vessels already. So it's already compromised, or high cholesterol. So they're prone to strokes or prone to clotting and things like that, and even diabetes. And one of the things that we have found out, because we find out new things about the virus on a daily basis, is that the virus actually gets into the pancreas and causes changes in those cells that are supposed to create insulin and help lower the levels of sugar in the blood. And what they actually do is flip it and increase glucagon. And so it actually increases blood sugar. And so, you know, if anyone has a family member with diabetes, you know how difficult it is to control infections, how difficult it is to heal wounds and things like that because of high levels of sugar in the bloodstream. So when that happens, it's very difficult to defeat this virus. About 1/3 of our patients still have to be placed on ventilators or high flow oxygen because they have respiratory problems. Our patients stay an average of 2 to 4 weeks, but sometimes longer. We still have patients who are staying with us 6 to 8 weeks before they either die or they're discharged. And we're still experiencing about 2 to 3 deaths a week in my hospital system, even with these low numbers. Younger patients are definitely having shorter stays However, some young patients do die. I mean, we've had a patient as young as 22 pass away in the hospital, but the average is in the 50s and the 60s right now. And I think it's important to remember that whether you get COVID as an outpatient or you get COVID and have to wind up being admitted to the hospital and stay, every patient who survives an infection with COVID-19 has some lingering effects, which we've called the long COVID symptoms. Or syndrome. And this could be chronic COVID lung damage, difficulty with breathing, a brain fog and memory problems. People have heart conditions because the lining around the heart is very susceptible to infection with the virus and secondary effects. People have persistent clots. People do have strokes outside of the hospital. And there's this generalized kind of chronic fatigue syndrome that people have. You can have abnormal heart rates and fainting and even chronic skin conditions because people get rashes when they're in the hospital and they can't get recurrent rashes once they're out. So I think all of those things are important. And then a secondary effect of just being in the hospital and being isolated and being connected up to all these different feeding tubes and IVs and different devices and things like that often leaves patients with something like post-traumatic stress disease. Or disorder when they leave because they have persistent memories and nightmares about being in the hospital. So I think it's important to remember that this is not a benign disease, even if you survive it. The second and third order effects can be quite debilitating. So if we can go to the next slide, please. So the next question is, here I am, I'm a dad, I'm a military veteran, I did 36 years in the Army. There were a lot of things that went into my actually getting the vaccine. And you see this picture, this is the day I got my first dose of the vaccine in January of this year. So first of all, I was in the Army for 36 years and we got vaccinated every year for something, whether it was a booster or because I was going overseas, I had to get special vaccines that would protect me. These vaccines were designed to protect me and also to protect the soldiers around me. Because one of the things, if I got sick, I could get other people sick and I could really decimate a unit and decrease the unit effectiveness. I have here, these are my shot records from 36 years in the military. It's 3 volumes. So I've taken an awful lot of shots to include rabies, anthrax, yellow fever, all kinds of things. So I wasn't afraid of the vaccines and I wasn't afraid of the fact that the military actually was one of the prime drivers in the creation of the vaccine. The second thing that, being in the hospital, as I walked through the wards, there were a lot of people on ventilators and things who looked like me. There were a lot of Black and brown people. So I knew that there was a disproportionate effect on people of color and minorities. And then I knew that I was equally susceptible because, I may look young and beautiful, but I'm over 60. I have hypertension. I've got diabetes type 2 for the last 5 years, and I've got high cholesterol. So I knew that I was at risk. So every day that I walked through the hospital or I put on my gear and went in and saw a patient and talked to them, I walked out of the room wondering if, geez, did I just get it? Am I going to die? And in fact, 12 members of my family had it. One of my brother-in-laws had it twice, had it in wave 1 and again in wave 2, which means he got 2 different variants of it. And so just having it is not protective in the long run. I had about 8 family members hospitalized and I had 4 family members who died. And so I said, this potentially is killing me, it's killing my family. And I did not want to bring it home to my wife and kids. And so when they said, roll up your sleeve, I rolled up my sleeve. I was not one of the first ones, unfortunately, because I wanted my frontline doctors and nurses to get it, but it wasn't for not wanting the vaccine. So that when they said, Dr. Coots, your number's up, I ran there. You see, I got a short sleeve shirt on. I was ready for it. I didn't even want to waste the time rolling up my sleeve. I just took my coat off and said, go ahead and stick it in me. And so I was very, very happy. And then I made sure that, once that we went through the sliding scale of who could get it, my family members got it as well, just so that we could all really be safe. Next slide, please. So the last thing that I wanted to talk about are the vaccines and are these really different? And I apologize, I made a mistake. That first thing shouldn't say DNA vaccines, it should say common vaccines, because these are things that, the gentleman earlier talked about, all the things that we have to take as kids, as adults. and particularly for children to go to school. Mumps, measles, rubella, flu, tetanus, polio, diphtheria, pertussis, all of these different things. Some of these are viruses and some of these are bacteria, but we've created vaccines to all of these. And some of these are DNA viruses as well. The different types of vaccines are inactivated vaccines, which are killed vaccines. So you actually have the real agent and you use that and inject it, but it's a killed version of it, and that ramps up your immune system. You've got what they call live attenuated, where the virus or the bacterium is still alive, but it is weakened to the point where it will not kill you or cause significant disease, but it will again ramp up your immune system. And then you've got the subunit vaccines, where you take a little snippet, a little piece or a part of the viral agent. Usually it is a virus, and that's what the mRNA vaccines are. They are these subunit vaccines where you take a piece of this genetic material and you inject it to create the immune response. The adenovirus vaccines, these are the live virus vaccines where they actually use the adenovirus as a carrier to carry the piece of the other bacteria or virus into your system to create the immune response. So there are all kinds of different ways that vaccines are developed. So to the mRNA vaccines, the ones for COVID and SARS, why are these so important? They're very important because RNA viruses are some of the most deadly viruses that are out there. So SARS-CoV, COVID-19 is an RNA virus. Ebola, dengue, all of these things that are based in Africa and will kill you in a heartbeat, these are all RNA viruses. And so it's very important that we work as hard as we can to create vaccines that will cover these viruses and protect people. One of the reasons that it looks like it was rolled out very fast is because, how do we advertise it? Operation Warp Speed. We're going to put a lot of money in it. We're going to get this thing out really fast. The president's going to take credit for it, the whole 9 yards. We're going to mobilize the military and get this thing out. We have been working on a vaccine for coronaviruses for the last 25 years. The Department of Defense has been working on it right here in Maryland at the Walter Reed Army Institute of Research is one of the big places where coronavirus vaccine research has been going on. One of the things that was a holdback or an obstacle to this was the fact that you need fat molecules to be able to stick together to place this little snippet of mRNA in to hold it long enough for you to get it into the body and ramp up an immune response. To date, we had only been able to get 2 fat globules to stick together, and then you had to have them ultra cold, but it was too cold to inject in the body. So when you warmed it up just a little, the fat globules fell apart. We now have the technology to put 4 different fat globules together, super cool them, but as you warm them, you can get them into the body, they'll hold the mRNA together and get it in and so that it'll ramp up the immune system. This is a 25-year process. I know a lot of the guys that developed it. I know Gus Perna, who was running the rollout. A lot of the guys I trained in the military were people working as project officers to get this out. And we were all jumping for joy that we finally had gotten a way to get a coronavirus vaccine out there. Now we're working on pan-coronavirus. We're working on the superbug to cover SARS-CoV-1, SARS-CoV-2, all of the different coronaviruses in one vaccine, because there are a lot of deadly viruses still floating around there in the world. We have not yet gotten to DNA viruses. That's probably even harder than an mRNA virus. And there are no DNA virus vaccines that are approved yet, but the federal government is working on those as well. So again, a lot of research went into this, years of work and effort, but the way we sold it, Operation Warp Speed, we're going to make this thing real fast and get it out there, really scared the bejesus out of a lot of people, especially people who did not have a lot of faith and confidence in the government.
So we'll only take 2 questions and then we'll move on to hearing from Catalina. So are there 2 questions? We only have time for 2.
I have a comment, if not a question, while somebody else thinks of a question. Maybe there's something to pull out of the chat. If you could stop sharing screen just for a minute, MyLinn. You mentioned that in the beginning, you said something about we're finding out new things all the time. And that struck me because I've heard in our discussions at Elevate Her, we've talked about this in some ways as sort of the greatest experiment that we've all been a part of ever in the history of life, right? And that has its own issue, right? Learning every single thing, every single moment. We didn't do this with the flu vaccine. We didn't do this with anything else. We're all learning it together. So when you, on the one hand, it's great to be learning things all the time, but on the other hand, that means you don't know things that we wish we knew. How do you make sense of that? How do you come to terms with that? That there's just stuff we're going to keep learning that actually might go against the stuff we said before. How do you make sense of that?
Yeah, well, I think that, you know, we are a learning people. I mean, if you think back 100 years when they had the flu pandemic, that lasted 4 years. There wasn't a lot that we knew about back then, and there wasn't a lot of technology that we had. I think the fact that we have ever increasing and ever improving technology allows us to learn a lot faster and allows us to implement those learnings even faster too. Because for the flu pandemic to last 4 years, to kill all the people that it did, we still didn't have a flu vaccine until 50 years later. You know, and even those were rudimentary. And so it took a while. With things like this, yes, we learn something every day. If you remember when we started off, we had nothing to treat with. And we used, you know, for a while, we used, you know, the drug that the president was talking about. And we found out, you know, that didn't work. And then we had remdesivir, which is a drug for HIV. And somebody said, hey, it's an antiviral, let's try it. And actually it worked. And then we had Toci and Octi and all these other biologics and things like that. But along the way, we were noticing funky rashes and things like that and said, wait a minute, why is this rash coming out? And then you heard about COVID toes and COVID fingers and things like that. And then we would see people with massive clotting and people having strokes. And why is this 20-year-old having a stroke? So we learn things all along. And like I said, the most recent thing we learned, and really that learning has just been in the last month or so, about what the virus does in the pancreas and why it is so deadly to people who have diabetes. So, I mean, this is a fast moving freight train. This pandemic was fast moving. Look at how fast it ran around the world, killing people. So we have to utilize technology. We have to learn as fast as we can, and we have to be able to implement things relatively quickly to continue to save lives and to mitigate the disaster that this virus is actually causing.
Well said. Well said. Briana?
Hi, Ms. Gloria, did you have a question?
Well, I was going to say that learning is regional as well and cultural. My family is 4 generations Shreveport and 5 generations Chicago. My mother was 5 years old when they migrated from Shreveport to Chicago in 1918. And I guess I learned to trust in medicines and all kinds of different medicines because of the women in my family. They survived the pandemic, and mother lived to be 97. And whenever something happened to my sister and I, my grandmother and great-grandmother would send weeds from Shreveport to Muskegon, Michigan for my mother to boil and say, give this to the girls. So I guess sometimes people just trust what they know and what they learn. And so what someone mentioned being hesitant because of the Tuskegee experiment and some of the other experiments, I learned to be trusting because it's what the women said to do. And so I trusted the women. Everything came from women in my family. And my father just said he was outnumbered. So he just went along with whatever the women said do. So I do think that we have to understand that learning is cultural and it's also by region. And we just have to be patient with those that are hesitant and not be judgmental of them, but to try to get them to understand why it is important and just ease them through this maze, because it is a maze.
Well said.
If I can add one story too about learning and things. My dad was a doctor in Tulsa, Oklahoma. He got out to Oklahoma shortly after the riot. So I'm a young child of much older parents. But one of the things that he told me about was the first use of penicillin, because we have to think, penicillin, we take it for all kinds of stuff, but we didn't have penicillin originally. And, penicillin didn't really come into use until the late 20s or the 30s. And so he said he remembered dosing a patient with penicillin, and the guy came back a few days later and his hair was shock white because it had stressed his system and turned his hair white. Back in those days, we didn't even really know and understand how to dose the new medicine. And so it was a learning experience trying to figure that out. So learning about a disease in progress or learning about a medication in progress as you're using it, there's nothing new about that either. That is kind of how things are done.
Mm-hmm.
Okay, so let's pull back up the screen so we can hear from Catalina Coots.
Next slide. So the first question is, what do kids my age think about the vaccine? Well, a lot of my classmates can agree that the vaccine does work and that anyone who is eligible to get it should get it. 10 out of 11 of my classmates have gotten the vaccine, which is good. And a lot of my other friends agree that instead of adults arguing about the QAnon conspiracies about the vaccine, they should just get it. It would be better for everyone. Next slide. Question 2. Was I comfortable getting the vaccine and why? I was comfortable getting the vaccine because growing up, my dad was in the military, so I would get all the shots for everything on time. So it didn't bother me to get this vaccine. Kind of immune to how shots hurt because of how many I've gotten. I was also comfortable because I wanted not only to be safe myself, but also to protect my family from the virus. Next slide. Question 3. What do I say to other kids who are wondering if they should get the vaccine? I would say to just do it. It might and it probably will save your life. So what are you waiting for? Get it over with.
Thank you so much for sharing your personal story with us. Thank you, the Coots family. We will now move on to our next presenter.
That's me. Hello, everybody. How you guys doing? Let me start. I am Belinda Queen. I am a servant at heart. As stated, I think you guys heard me earlier say I raised a lot of kids. I've raised 21 kids, 3 of my own, 9 stepchildren, and 11 foster guardianship. I am a proud author of A Mother's Special Hand, written by Queen Bee. What are the current quarantine guidelines for students, especially siblings, and where can this information be found? This information can be found if you go to our PGCPS website. Once you go to the PGCPS website, if you just stroll on down where you see COVID guidelines and COVID information and click on a card, and it'll give you all types of updates on COVID, and it will also let you know about the guidelines for COVID. So you can go there, and I can just let you know a little bit of how the random COVID-19 testing is going in school in a little bit, but the guidelines is on the website. My assistant, Ms. Prashad, is on the line. Prashad, can we have you to drop the link in so people can find more information about the COVID guidelines? But right now, there's the guidelines differ depending on whether there's confirmed cases, just so you can know for people who not able to go to the website. So there is a confirmed case. If it's a positive COVID-19 positive test, we have certain guidelines for that. If it's a probable case, we have certain guidelines for that. If it's COVID-19 symptoms, maybe known exposures, and if a person is experiencing COVID symptoms, you could be just experiencing the symptoms, but not sure if you have it. So certain guidelines for all of these things. And if you had a negative COVID test, and an alternative diagnosis, but all of these guidelines are on our website. Some people have been, relatives have had COVID inside the household, and other ones have not had it. So it's guidelines for that. It's guidelines we have on there for if one person get it within our school, how we close down the school and how things done. And finally, if a household member has been confirmed or probable cases, all of these guidelines on the website. But I'm going to yield right now to Dr. Jones to speak on the specifics relating to quarantines on these guidelines.
Good afternoon, and thank you, Board Member Queen. So right now for the guidelines, if someone is positive, they automatically get 10 days. The one thing that I am total agreement with Dr. Coots is that we are learning every day. Everybody's quarantine time is different. Their quarantine dates are different. It is dependent on when they were exposed, when they got tested, if they were symptomatic. So I can give very general information, but the actual specific of when people start and when people end will depend on additional information that we have to receive before we can provide the totality of what we're facing. So right now, in general, anybody who is positive has to be isolated for 10 days. If there's a close contact, we have now recently changed our guidelines so that if they're identified as a close contact, they are unvaccinated, on day 5 after the last day of exposure, they could take a PCR test. If they get the result back on day 7 and it's negative and they continue to be asymptomatic, then they can return to school on day 8. However, they still have to monitor for signs and symptoms through the entire 14-day time period. In order for them to return back to school, they do have to provide the proof of the negative PCR upon their return. If the parents opt not to have a PCR test done, then they will have to do the entire 10 days of the quarantine period. Now, as it relates to the siblings, it is really depending on if the siblings can be separated. In order to isolate, you can't be in the same bedroom, you can't be using the same bathroom, you can't be using the same kitchen area. And if they're unable to do that, then we would have to start that siblings quarantine time after the initial sibling who was positive completes their isolation time. So the sibling could in fact be out for quite a number of additional days based on the dates and whether they could isolate or not. Next slide. So for random testing, this is just some information just about our random testing. We started it September 28th. We random test 10% of the students within the school building. Each student has to have a signed consent form. We're using 2 vendors. The vendors are assigned different schools, and then based off of what school they are assigned, they make up a schedule, whether they go on a Monday or on a Thursday. And again, everybody has to have a consent form. We are signing up all families, electronically. So if you have any friends or family members that have students within our school system, please make sure they sign up so they can get this random testing. once they are, we get the results back within 24 to 48 hours. If they're positive, they let us know. And then, and they should also be calling the families and letting the families know that their child is positive. And then from there, we take it from there and we start doing our contact tracing and identifying who's positive versus who's a close contact.
And before we go on, as a board member, I have not heard of many complaints. I'm not going to say any, but many complaints regarding the random testing. Excuse my phone for ringing. But the administrator normally works specifically with the vendors and provide the testing for students and staff. So Mr. Burnett, you're on his. So with the random testing done, have we had many complaints or concerns about the testing being done in the school system? Because I know that was one of the concerns about how the random testing is going.
Yes, Board Member Queen, I think one of the things that helped the acceptance of the random testing was that we started testing students when we brought them back last April. So we would test students who may have been symptomatic right in school, and then we would also test anyone who may have been in close contact, whether it was staff or students. So we pretty much in the region kind of led the way with regard to how we would handle the challenges here when we started back in January to organize the opportunity for our staff members to be vaccinated. And so the random testing was just a piece of the whole puzzle so that we provided that opportunity. And of course, parents have to agree to have their child tested, just like we were leaders in terms of having our K-6 students, the 12,000 out right now who are doing virtual learning. We're one of the only school systems that offered that because there was not a vaccine. But now that there's a vaccine and we have so many clinics available to our children, you know, we expect them to return the second semester as planned.
Thank you so very much. You can move to the next slide. Will Prince George's County Public School be offering COVID-19 vaccines to students and when? Wow, as of today. Did one of you guys want to give that information? I know, I'm glad to say, I know we have a lot of clinics and our CEO, Dr. Dawson, made sure that we did it north, central, and south to make sure we were covering everybody. So Traci, did you want to give an update on it?
So we actually have 15 high schools throughout the county that we are providing COVID vaccines to. 5 in the north, 5 in the central, and 5 in the southern part of the county. In addition, we have about 40 elementary schools who have elected to have the vaccine clinics actually come to their schools and provide their children the vaccines on site. So we are anxiously awaiting for everyone to get vaccinated. That is our hope and our goal.
Yeah, and you guys can go to www, go to pgpcs.org, and you can sign up to get vaccinated. You can schedule an appointment, and it's not just for our students. If you, as a parent, you know, have not had a vaccination, if you have maybe a family member who want to take the time and get a vaccination at the same time as one of our scholars, we'll be glad to vaccinate y'all. We're accepting everybody. We're not just doing our scholars. We're trying to help and make sure that everybody is protected. Because as Mr. Burnett just said, we in February, we want to be able to operate as a full school system. We want our staff, we want our students, and we want our community to feel safe. So as many people as we can get vaccinated to make sure that everyone is safe, we will be doing that.
And Board Member Queen, just as when the vaccine was became available for 12 years old and older, we provided the clinics for all of those students, and more than 70% of those students received the vaccine throughout, you know, those clinics that we provided. And that's one reason why we didn't provide a virtual school safety type program for that age group. And we encourage those who are not vaccinated to take the opportunity if they choose to do so.
And that will be it, Traci, now unless you have anything else that you needed to add.
I did hyperlink the clinics too, in case anybody wanted to have access. So I see you put it in the chat as well.
Yeah, and I just want to, close out our presentation and say we just want to make sure that our scholars and our staff and our communities are safe here at Prince George's County Public Schools. We are here to serve. We are also here to educate. Going through COVID right now is an educational lesson for us all. And we have to work together. I believe in saying that we work together with the community. It takes the village. And you are part of, each and every one of you are part of the village. And we as a school system in Prince George's County Public School, from our CEO down to the staff, the cafeteria worker, we all are trying to do our part to make sure we're doing what we need to do to be vaccine, to make sure our school system is operating safe. So when our babies come to our school system, they leave back the same way, in a safe and a secure manner. So I just want to say thank you for this opportunity.
And we do have 2 more quick slides. So if you go to the next slide. So we'll just, I'll skip the fast facts. Go to the next one. So right now we actually have a couple of testing programs in place. We do staff testing for unvaccinated staff on Monday. We do the random testing, which we just talked about. And then we've also started testing our athletes that are unvaccinated. They are either tested on Wednesdays or Fridays. And also, as Mr. Burnett mentioned, the nurses in the school are able to test individuals who are symptomatic. I can't explain enough or get people excited enough. We need those consent forms so we can do more testing in the schools. Without them, we can't do that. Next slide.
Traci, on that staff testing, we're one of the only school systems in the state that required the completed vaccine, or staff would be tested every Monday. So, about 88% of our staff are fully vaccinated, but we test those who are not and choose to not be fully vaccinated every Monday.
And we make it easy for our staff. We have them, in the school settings, and we also have central locations that they go to. So, we encourage, we're trying to protect our kids as much as possible. We're trying to protect our staff as much as possible by doing these testings on Monday. The question of will vaccines be required in the future for students in the buildings as it relates to COVID, right now, it's a wait and see. Until the state of Maryland makes it a law, then we cannot mandate it. We can ask parents to do it, but we cannot mandate them to do it. So we're in a holding pattern at this time. We're encouraging all parents to get the vaccines for their children. Next question. So for remote instruction, I'm going to have to yield that to either Mr. Burnett or Board Member Queen, because that is not my area of expertise.
Okay, so for what remote instructions are being given now when students have COVID right now, what's been going on, if they bring in their letter from the doctor, they've been allowed to be excused, and some have been allowed to make up the work for the ones who have COVID, and that's how we have been going right now. For options available for people, and same thing for when they have to be quarantined. And so that's what we have for our non-vaccinated students. Right now, even with the non-vaccinated students, if the only time they would actually need remote instruction if they have to be quarantined, and that would be the same for even if someone who actually was vaccinated and hit it, because it was stated earlier that it is possible that could happen. It's still the same thing. If you get a doctor noted and you have been tested, it was stated earlier, we give the 10 days or whatever is needed or required from the quarantine, and you will be excused if it's a makeup work or makeup test that would have to be done. We are following the guidelines of our students, our scholars being at home, but they will be allowed to make up whatever is needed, but we want to make sure they are quarantined in a time that we'll be required to have them quarantined.
Yeah, and we do offer certainly online an array of asynchronous instruction and activity for every grade level, for every child and every subject. So they can go online and they have the support of their classroom teacher if they have questions on that instruction during that quarantine period. But there's a fantastic online program at every grade level in every subject for our students who are quarantined. And we're going to offer an outstanding tutoring program for every student in every grade level, working with our Teachers Association that will start soon and go throughout the year in all subject areas, which will be after the normal school hours provided by our teachers twice a week.
And we're excited about that. We really are, because we all know that because of COVID, it was, and I wouldn't say an educational loss, but some of our students do need just a little bit of help in catching up. So we're going to offer this tutoring to make sure that Prince George's County Public School scholars are able to excel. And so we are definitely excited about this, that fact that, you know, the PGCA, which is our union, the teachers union, has partnership with the school system, and they realize how important it is that we make sure that our scholars and your baby are exceeding in great ways, so that when they go out here and they're able to graduate from the school system, that they will also be productive citizens. But not only that, they will be able to succeed in whatever they decide to do when they leave Prince George's County Public Schools. And I think that's it. Is it another question, another slide?
For us.
That's it.
So thank you so much for our board members. Are there any questions? We can take 2 questions before moving on to our next speaker. Questions or comments?
We got a lot of hand claps in the chat. We'll
Let's
save
get
that
the
and send
hand
it
up
to you.
by Nicholas. Nicholas, you have a question?
All right, I guess people can see my video. Can you hear me?
Yes.
Okay, so I don't know if I'm jumping ahead on this part of the presentation, but I will just ask one question. As far as the COVID-19 shots, I've gotten my standard requirements of the 2 in my left arm. But what happens if you get a booster shot after that, or you get more COVID shots after getting the requirements? Does it boost you, or does it just not really affect you too much either way?
Well, I think the doctor's going to have to answer that. But Nicholas, I'm going to tell you, today at 11 o'clock, I got my booster shot today, y'all. So, you know, I got my booster shot today. So I have lupus, so I need to be very careful with having lupus. So I definitely made sure I got my booster shot. And I feel fine after having my booster shot today. But the doctor may be able to tell you more about the effects, or if it's going to be other ones.
Yeah, it does. And so the booster does exactly that. It boosts your immune system. I mean, if you think about it, you know, you take a tetanus booster every 10 years. And there are other vaccines that we take where you do take a booster periodically. Again, we're learning as fast as we can about the effects of this. You know, this is one of the few true RNA vaccines we've been able to produce. And this is the first one that so many people have taken. So being able to track what the level of response is over time. And as the scientists saw that there was a drop off, they said, okay, we need to have a booster. We always knew that there would have to be a booster, but we thought it would be a year, maybe 2 years down the line. When they said, no, it needs to be at the 6 to 8 month mark, then we said, okay, they obviously learned that there was a tremendous drop off. And I think the other thing too, is there are so many variants that are developing that the booster ramps up the immune system enough to cover the bulk of the variants as well. When is the next booster going to be due? I don't think we know yet. But it's anticipated that once coronavirus becomes or COVID-19 becomes endemic in the population, meaning, you know, it's a disease that's seasonal, or we see it constantly amongst people, but at low levels. This is going to be like the flu. We get a flu vaccine every year, right? We get a flu, but basically that's a booster every year. And so more than likely, we will wind up needing a COVID booster annually as well. I got mine, and my immune response ramped up, and I felt it. Starting 2 and 3 days after I got the vaccine, I knew I had gotten a booster. And then, that response waned, but I was very confident in the fact that it revved up my immune system, because I could feel it in my lymph nodes. I knew that my immunity was up.
Quick follow-up question. Is there any reason to believe that the need for a booster would be different for children versus adults?
No, I think we're finding that everyone is going to need a booster. The question is, because children's immune responses are generally much more robust than adults, they may not need the booster quite as frequently. But the older you get, the less Florida response you have, the more likely you will need a booster sooner. So I'm interested in seeing that too, whether or not kids need it at the 6 or 8 month mark, or whether they can stay a year or two without having to get a booster.
Hi. Thank you so much, Dr. Coots. Sorry, we will have to move on to the next speaker. If you have a question, please put it in the chat and we will address it.
Okay, so yeah, that's me. My name is Rachelle, as I said before. Some facts about me. I'm a member of Delta Sigma Theta Sorority Incorporated. I'm an owner of a Beagle Jack Russell mix named Vincent. I adopted him, and I'm addicted to Starbucks. So this is some of the questions that I am going to be, and Fatima is my last sister. But so these are the questions that I'm going to be going over. But I wanted to talk about my COVID experience. So I was affected fall 2020. So that was before even vaccine rollout was really in the conversation. It was going through all the approval processes, as you guys all may know. And I had it right before election day, and I was able to vote. So I was really happy about that. The day I was able to leave isolation, it was I was able to make vote. So during that time, I did experience all those symptoms that people were bringing up. But at first, I'm not gonna lie, I was in denial of the disease, and I feel like that's what a lot of people do. You just assume, oh, you're just sick. Oh, you just do that. But no, you really are sick, and you need to go get tested and do what the proper steps is to make sure your community is safe. But so my whole I was me and my roommates and I, we all ended up having COVID together. My university had a strict COVID policy. So if you had it or anyone had it, you had to go to emergency housing, which is far on the other side of campus. But since we all had it, we were able to stay in our apartment. So that was a special case. But we were in isolation for about 10 days. But during that time, not a lot of people bring up the feeling of anxiety and guilt, because when I said before, when you are infected, you are in denial and you're still operating and going around people, even though you don't know you have it until the last I guess when you finally get the results back saying you're positive. Then you have to start contacting everyone that you need to or have been around, and that just feels you feel guilty in a sense, even though you know it's the right thing to do. So that was that feeling. And then of course the lingering side effects of COVID. I did witness I did not know if I was going to ever smell again. Luckily I did have that. And before the vaccine came out, I was previously hesitant about it, and people my age too, there's theories saying that the government's tracking us and stuff like that. But if you really think about it, we carry phones every day. They're already tracking us. That was the mentality we're gonna have. And then also the ignorance of I already had it, so I probably won't get it again mentality. And then also my family, part of them is from the South, and they don't have the substantial information of healthcare as we do up here. So that also was having me hesitant. But also one thing that really pushed me was as a public health science major, my professors really adopted like the COVID curriculum, and really just like we were obligated to like really learn everything that's happening as it is relevant to the coursework in our classes. So I needed to do the necessary research that in which like further convinced me that it was important. So specifically why I got vaccinated too, like both of my parents were in the military. So as mentioned, from Catalina, like I understand that because like once I was eligible, I got vaccinated. And then also half of my other side of my family is a part of the medical field. They're nurses, doctors, health professionals of any way. So they also stress the importance, and also like some of my family members like have they're immunocompromised from like cancers and stuff like that. So I also wasn't really thinking about getting it for myself, but also protecting them. And then, like I said before, as a public health science major, I was obligated to do research in the complexities of COVID. And also like why I got vaccinated even more is that I was continuing to do research. Like there was documentaries and stuff like that was published like on Netflix and stuff like that was accessible for people that people really don't take advantage of, such as like the coronavirus explained on Netflix, which really goes into like the coronavirus is not something that was found in 2019. Like this is something, it's just something like the strain was really like pushed into the pandemic that we know today. And also as a student, I wanted to go back to school. Like I did not really enjoy in like virtual classes. I did have COVID fatigue, and I know a lot of other students have faced that as well. But another thing that I didn't, this is aside from like my personal testament of COVID, but like COVID had honestly influenced a lot of policies within the state that not a lot of people are aware of. And I took some notes of such as the Maryland Healthy Working Families Act revisions, the Preserve Telehealth Access Act of 2021, and the Maryland Health Equity Resource Act. So these are some things that people really like, even though like COVID and all this adversity has happened, there is like some pros that have came that us Marylanders are going to take advantage of in the future. So specifically with the questions that I've like jotted down on the screen. So the first one was, how has the effects of the COVID-19 pandemic affected mental health of college students? So as I mentioned, like I went through COVID fatigue. All of my friends and loved ones or college students have also experienced COVID fatigue. And like we really wanted to, and we wanted to go back to school. So moral story, so on UMD's campus, 98% of our student body is vaccinated. And for those that are not vaccinated, we are obligated to get tested very often. But also like during the time and now for real, like students were going through depression. And also there was a mental health provider shortage. So especially affecting out-of-state students where they couldn't seek, mental health providers within people like at the University of Maryland because they were out of state. So that affects the telework. I'm sorry, I'm trying to go faster. The second question was, should institutions mandate the vaccine booster for students taking in-person classes? I really said mandate versus strongly encourage is very different. And at my institution, UMD strongly encourages the vaccine. Right now, like at my institution, they are providing the Pfizer vaccine at our University Health Center for all students, faculty, and staff. And we're all eligible since the campus is like at a high density. And then my last question was just honestly just an open-ended question, just for everyone to really like ponder, like how can we educate the Black community on immunization? Because it's not just the COVID-19 or the COVID vaccine, it's also the flu and all different shapes and forms of vaccines out there. Thank you.
Thank you, Rachelle. So now we will move on to our last speaker of the night, Miss Valarie Davis.
Good evening, everyone. I am not going to keep you long, but I'm just going to keep you long enough. I started Elevate Her with 9 other Black women in the pandemic when we just decided we were done with the number of Black people who were dying. We didn't have any money. We didn't have a plan. We all had jobs and people and grief and other, things to focus on, but we decided we needed to do something. So that's where this company started. And other things, I love to dance. I have a 14-year-old who just wants to get on a plane and go somewhere, and a dog who's sleeping on my feet. So I want to end with really, I believe, such a fundamental question that everyone seems to have, whether you're Black or not. But where does my personal choice and the government, employer, or school mandates begin? This idea of having control over your choices. Next slide. So here are some facts. The first is that the choice is always yours. You always have the choice. So it's a false narrative to talk about people taking away your choice. You do have choice, just choices have consequences and they involve trade-offs. And that's how we live our lives, right? This is no different. But all choices are imperfect, because as soon as you make a choice and you get new information, you decide again. So the good news is that very few choices are final. Those that ultimately end in death can be final. But as it relates to this, I want to undergird that these are always our choices. Next slide. But when I went to think about how I was going to look at this is just some data that I think we get away from because the numbers have gotten so big around COVID. So on the left side, where you see the red and the gray bars, you see by race and ethnicity. And again, you'll get these slides, how many cases there have been as of November the 7th. And for Black people, Black/African-American, with only 65% of cases actually having race or ethnicity data, 2.87 million were Black folks. That's a huge number. And just let it sink in, 2.87 million. And how many people died? Over 72,000 of us are dead. And you can see that on the right-hand side, that's slightly higher than our percentage of the population. So again, we are disproportionately affected. That's what that means. And I just want us to hold on to those numbers, not because we hold on to the grief, because those are some of the facts. That not only are we're missing thousands of people who will never be here, and millions of our people are going to have some kind of long-term effect, and it's affected their families, their jobs, their money, their health. But that we have, these are some of the facts that go into making decisions. Next slide. So the last piece of data that I think about, I track, and I didn't know I was getting into a 7-day-a-week, 24-hour business because I was not in healthcare before, right? But that's what this is, this work, community and public health. If you look at just on the bottom 2 slides, that bottom line, that's the orange dotted line. This is the percentage of African Americans and Black people over time that have received the vaccine. So all the lines go up, right? Because every race and ethnicity is getting more and more. But look at that row of numbers at the top where it points to Black, non-Hispanic. The first line is what percentage of us have received at least 1 dose, and what percentage of us are fully vaccinated? 39.1 and 34.8. Those are the lowest numbers of any race or ethnicity as of November 7th. Just let that sink in. So when you hear disproportionately affected and you see all these efforts to come into our communities, these are the numbers. The trend's still good, it's going up, but we're still at the bottom. So next slide. Here's how here's how it came into my life. Here are my criteria. I'm just going to share with you. On the top right-hand side, you see my mom and my dad. They were young and fly. My daughter on the left, who's 14, some of my wonderful team of community health workers and the company that we have formed. And so I think about several things. One, I'm a single mom. I'm it. I can't go down. It's just me. Secondly, I'm a caregiver for my mom. So I can't have anything that would make caring for her more difficult or put her at risk. Thirdly, I have some short and some long-term goals. And if anything's going to get in the way of them, then that I can do something about, I'm going to do just that. And for me as a single mom, I got to work. because next summer I'm buying my dream house. And the only way I'm going to get there is I make money to buy the dream house. So I have to stay healthy. Fourth, this is really important. I look at the short-term knowns, what we know right now, what we know. And one of those things is that I am less likely to die if I get a vaccine. Not perfect, but less likely. That's a short-term known versus my long-term unknowns. I hesitated, not for myself, but for my daughter. And I said, I'm not doing this vaccine thing. And I told everybody, I said, until all the other, I'm just going to say it like I said it to other people, until all the little white kids have had a vaccine for a year and they didn't grow extra ears or arms, or they haven't had anything happen to their reproductive system, I'm not doing it. And I thought, how would I explain to my daughter 20 years from now that a thing I gave to her when she was 14 has kept her from having kids? That was my running narrative. And then as the Delta variant went bananas, I said to myself, the thing I know right now is that this will keep her, is more likely to keep her alive. That's her short-term known. The long-term, I'm gonna leave it to God and the evolving science. So my last thing is my faith and my purpose. I believe I'm here for a reason. She's here for a reason, and we got to keep going. So I don't know what your criteria are, although all of us will make our own choices, but that's how I made mine, to finally walk my daughter up to the clinic and say, here's her arm, and we talked about it. And lastly, I'll just point out that globe in the bottom. When people say, it hasn't been out there long enough, it needs to be tested, just know this. Look at the number of doses that have been given around the world. If you didn't think it was tested enough, that's a huge number. 51.5% of the world's population has had at least one dose of the vaccination. So if you want to look at this as a great experiment, there are some of your numbers. Do what you want with them, but it's important that we operate based on facts and we make our own informed choices. So that's all I have. I turn it back over to you, Briana, to wrap us up.
All right, next slide, please. So what's next? If you still have questions and you weren't able to get them answered at this event, please feel free to email us. Our email is right on the screen. Also, please fill out our post-event survey. This helps us to know if we actually made a difference. If you guys were able to learn anything from this event, it's the same questions as the pre-test. So it's super easy, it takes 2 minutes. Please do it. And then also download our app as well.
Like, do it now before you get off the phone. Don't wait. It's in the chat. Please just don't do it. You will not get a post-event survey. How is this? Rate us. This is it. So please take a minute to do that. Sorry to interrupt. Go ahead, Briana.
Yes, and then also please download our app. We recently launched it this year back in October, and it's called the Let's Do Good app. And the page that you're going to follow is Black Health Facts, but we kept it simple. We also put the link in the chat box for you guys. So if you just press that link, it will directly take you to the App Store to download the app, and then you just create an account. This way you can get updates sent directly to your phone about COVID-19, and you don't have to worry about getting misinformation. Also follow us on social media. You guys keep seeing me put that in the chat because I really want you to do it. So yeah, follow us on social media. And let's go to the last slide. So thank you guys for coming. Again, please fill out that post-event survey. And if you do, you might win some Black Health Facts merchandise. So I would do it, get a free hat. So yes, please take 2 minutes to do that. And thank you guys for coming. Email any final questions to us. And thank you to all the panelists, because this was thrown together in a week, you guys. So thank you for making the time to come here. We had, a doctor, we had some Prince George's County board members make the time for tonight. So thank you guys for coming, some personal stories. So thank you guys.
Yes, thank you very, very much. Put any comments you have in the chat. Now you're part of the Elevate Her family, all y'all. You'll hear from us. Please follow us because we want to follow you and we want to be a source for comfort and facts and good health. So with that, we'll say good night and be well. Night, everybody.
Thank you.
Good night.
Thank you. Good night, everyone.